Hi, Facebook. It's Sarah McLeodry from Synergy Behavior Solutions, and I'm coming to you from actually a sunny Portland, Oregon today. I know, crazy talk. It is, oh no, it's February. Not, oh my God, it's February. And the days are getting longer. It's not pitch black out at 5:30 anymore. It's so exciting. Um, so, welcome to my Facebook Live today as I ramble here about being in the Pacific Northwest and how much I love it. Hey, sorry, folks in the Midwest there and all of your snow. I do not miss all of your snow. I'm going to change monitors here so I don't look like I'm staring out to outer space. Um, so, Today, I want to talk about the concept of know better and do better. And I want to actually first give a shout out to Lorena, our other trainer, because she told me, I did not know this, that quote is actually from Maya Angelou, who I adore. And just, I guess I've heard that quote so many times, you sometimes forget where things come from. And so I do think it's important to say that it does come from her. And the reason I wanted to talk about know better and do better for the animals today was last night we had a Facebook Live. And if you joined us there, thank you for joining us. If you did not join us and want to hear what Lorena and I had to talk about during our trainers talk, you can go ahead and look at our Facebook Live tab and see that. It was a pretty lengthy discussion and lots of really amazing questions. But while we were talking about that, the question came up about medications for use in pets and when to use them, things like that. There's a whole discussion. Go watch it. I'm not going to get into that right now. But it really reminded me of a lot of old feelings. So I just want a little bit about me. I started dog training as a kid. I had a schnoodle long before doodles were a thing, back in the 80s. And I did 4-H dog showing with him. And I literally taught him what to do out of the 4-H handbook. I never attended a class. I never did anything. But I rode horses, so I figured I could handle dog training. I, of course, had a choke chain on him because that's what they told us we had to do. Then fast forward to my college days, and I was in art school. I have a degree in photography, and I was doing a photography project about a service dog organization who so I then got very involved with volunteering and eventually met my husband through things like that. Very exciting. But they were very punishment based in their training methodology at that time. This was also in the late 90s. And we refer to him as Bailey Bad Lab, was my husband's service dog. And Bailey Bad Lab wore a shock collar and a prong collar at the same time in public. I have handled that shock collar. I've done it. I've been there because I didn't know any better. I was told by this organization that this was how it had to be done because this dog was a service animal and it must comply at all times, et cetera, et cetera, et cetera. It clearly was not working, which is how I ended up being a dog trainer. Long story short, ended up at Dr. Karen Overall's veterinary office at University of Pennsylvania, and now I'm the head trainer at a veterinary behavior office myself. So funny how the world works. But I would beat myself up a lot for a very long time about Bailey. I felt horrible. I had caused a lot of pain and suffering to him. I knew it was wrong in my gut. I'm a vegetarian. I have been since I was 16. I loved animals. It was very important to me. But I did what I was told to do and was I told was needed for the situation. And I still to this day will never forget the day that he broke our front door trying to attack a dog out on the street. And he was screaming in pain when I hit the button to his electronic shock collar and looking at me screaming in pain as he went to go after that other dog. He was eventually retired as a service dog. It was not appropriate for him to be trying to react and be aggressive towards other dogs as a service dog. Um, but I will never forget that feeling and how. And finally, I did get to the point where it's like, I didn't know any better. Doesn't give it a complete excuse. Internet didn't exist, couldn't really get information about training like we can nowadays, but I didn't know any better. And I also was not ready to hear something different. And that's another big thing about know better and do better is you have to be ready to hear. Because I also remember with Bailey, one time he was at I used to work retail, and he was at the shop I worked at wearing his shock collar, hidden under a neckerchief because if you aren't comfortable with your methodology. You hide them, which tells me something right there. Um, so, and a customer came in and really read me the riot act about having a shock collar on my dog. And I went into the whole spiel about he was a service dog and how this had to be, and et cetera, et cetera. And I wasn't ready to hear it. And that's okay because I needed to get there. So I also at the time had my border Kelpie Scout. And that's another one, know better, do better. I look back at Scout's life, and Scout had just a host of noise sensitivities and fears and phobias. She most likely, I got her probably around 5 weeks old. I was told she was 8 weeks, but looking back on puppy development, things I know now, she was clearly not 8 weeks old. Um, her noise sensitivity to actually the sound of a clicker was so severe that if she heard a clicker, she would bolt into the bathroom, jump into the tub, and try to climb out the bathroom window. I did lots of things to try to help it, but I didn't really know how. And I regret not having put her on medication to make her life easier. I did have a mentor of mine for positive training actually at one point tell me I should just put her down, that her quality of life was so poor. And I really, truly don't believe that. And I still don't believe that to this day, that her quality of life was that poor. I do believe she had a lot of struggles. The last 3 years of her life, she actually went and lived with my parents as a only dog and lived a wonderful life. She did not like being a multi-dog house dog. Um, and I do not regret not euthanizing her, but I do regret not giving her additional help that I could have. But I know better and I do better now. Hi, Mallory. Mallory popped in and is saying hi. Mallory and I actually were having this a little bit about this discussion this morning. That's why I'm talking about it also. Um, and I think a lot of people who have reactive dogs, dogs with issues, there is a lot of guilt, a lot of shame, a lot of concern that they didn't do things right. And you can only do what you know. And so, what can we do better? And I think about a big paradigm shift that I have seen in training has been when I first started in positive reinforcement dog training. It was considered going to the vet behaviorist was considered a last resort for dogs, that you have done everything, you've seen all the trainers, everything, then you go to the vet behaviorist. And we are starting to finally see a paradigm shift that it is vets are now referring to us with puppies. When they see baby puppies who have very significant issues, they're referring them to us, and what a difference it makes. And I think that's a great paradigm shift. I think the other paradigm shift that we've seen that about knowing better and doing better is working on, obviously, just positive reinforcement. I think about when I started my training business in Illinois in 2004, it was unheard of to be doing positive reinforcement and to be doing positive reinforcement for sports. I was a competitive obedience person at the time, and I also did retriever field trialing with my dogs, all with positive methodology. And that is now starting to come out. The joy of the internet. Thank you. That is one of the biggest things that changes. Anna popped in. It's like Fitz. I think of Fitz often, actually, Anna. So thank you. Fitz was a training client and with Anna with me. I was told at 8 weeks when I got him, but he suckled for almost 6 months on blankets, etc. I strongly believe that the breeder lied to us. And Fitz had a tough life too. And I understand that it's so frustrating. I also bred. So speaking of know better, do better. I bred one litter over my years of having Nova Scotia duck towing retrievers, and I sometimes regret having not bred my girl a second time or a third time. But in that first litter, I produced a dog with horrific hip dysplasia. She needed a total hip replacement at a year of age. As a pretty small dog, she's only about 29 pounds, and she needed her second hip replaced when she was about 6. And she lived till 14 plus years. Amazing, amazing dog with her bionic hips. And it was one of those things that I knew to do better. I wanted to breed my girl again because her temperament was amazing. And I got another dog to hopefully breed because I did not want to put hip dysplasia continued into the lines. And her temperament was a little wacky. So I decided not to breed her. And then another dog, I didn't really love her temperament either. And I really, dogs need to be, um, they need to be pets first. And I think breeders need to be very upfront about that. And that also rescue groups, actually. I'm going to call rescue groups out on this, that people do not get, this is a know better, do better rescue groups. Listen to me. People do not rescue dogs for a project. They rescue dogs to have a companion and a pet. And the more you are putting project dogs out there, either from a breeder or from a rescue, I see project dogs on both sides of the spectrum. So it's not just rescue dogs. But if you are putting project dogs out there, you are taking somebody out of the ability to maybe have another dog, rescue again, things like that. And I think it's really important that we need to do a better job of getting to know our those rescue dogs before you place them in families. That's a definite big thing we've seen with the pandemic, is we've seen a huge influx of newly rescued dogs that have some very significant behavioral concerns and issues. And so yeah, that's a big one too. Natalia, I grew up watching a famous animal trainer that used to use the alpha mentality, and I didn't know any better. But thankfully, we learned better training methods before rescuing the sweetest dog. Yes, I cannot say that enough. And if we could get all of those, some of those very famous trainers off of our airwaves, both on YouTube and also Netflix and cable channels and regular channels, it would be super helpful because we know better and we should be doing better. Um, Also, too, I am personally not on TikTok. My son is, and he has seen nothing but an influence, a huge upswing of punishment-based dog trainers on TikTok, and I've trained him well. He actually reports them whenever he sees anything he feels is very inappropriate in the training methodology. He actually reports it as animal abuse, which I give props to the Gen Z about that. So, but oh, and Kona's Touch is here. Hi, Laura. I know Laura is in the same boat with me. The very first trainer she had for her dog, Kona, did some horrible things to her dog too because we didn't know better. So yeah, so we've all been in this boat, and I think that's part of why I wanted to talk about this today is we've been in the boat, but it's okay, and acknowledge it and pass it forward and go on. Give people the knowledge and keep going. Anna Berg, TikTok. What did you? So many people think they can fix their dogs in 60 seconds or less. Oh yeah, that's a problem. I would It's also actually our issue with the rescue dogs where people really feel that just more love is going to fix them, and that's not necessarily the case. Mallory says that there needs to be a level of transparency for both breeders and rescues regarding behavior issues, especially with the rescues. It's super important to clearly inform so that people know what they're getting themselves into. It's a win-win because they will be more suitable homes and help drive down returns. Exactly. Our goal is forever homes, not temporary homes. And it doesn't mean that if you have to return a dog, if you're a failure. I've actually rehomed a couple of dogs because I've known better and done better. I knew that Scout lived in a very stressful life in a three dog household. It was not what she wanted. I had another dog that I had another toller, Neela, who I was hoping to breed. She had unfortunately had bad hips also, because if you sell me a dog, I get bad hips. I don't know. That's a story for another day. The I ended up when she was about 4 years old. A friend of mine had actually been waiting for a puppy from Neela, and she was obviously not going to get that puppy because I was not going to breed a dog with bad hips. And I asked her if she would rather have Neela, and she was at a place where really a puppy wasn't probably suitable for her home. An adult dog was much more suitable, and um, she went and lived up in Milwaukee, Wisconsin. I remember about a month later, I went to go visit her, and she was very excited to see me. And then when I went to go leave, she like put herself in not Katie, not the owner, Neela. She put herself in the farthest part of the apartment, was like, great to see you. Great to see you go. I do not want to go home with you. And it broke my heart a little bit, but it also told me that I did the right decision and I did know better and do better for the pet. Hi, Debbie. Debbie has an amazing dog named Nellie who does nose work with me. Glad my vet sent me right away to a behavioral vet as soon as problems were seen. And that is true. The other thing is, as clients, be willing to listen. We see a lot of times in clients' paperwork that their vet has recommended seeing a vet behaviorist, and they have been either afraid, worried about, however many reasons they've put up roadblocks and they haven't done it. And so I think that's the other thing, is being open to other options. If your vet is recommending it, there's a reason. They're not a specialist in behavior. And so they're trying to get you and your dog the best. Anna said, we need to take a break of we need to break the shame of rehoming a dog for sure. Dogs should be with the handler and the environment that fits them best and their temperament. And that is so true. I want to give a shout out to a former client, Ellen, with a dog named Shiloh, an Aussie back in Illinois. And he was actually living with another client of mine. He had been tethered out in a yard for 3 years. Once again, know better, do better. Go support Fences for Fidos here in Oregon. They're an amazing organization. So the client adopted him through friends of the family that had this dog tethered out in the yard. He was a wonderful dog. He really did well considering he had a pretty rough start in life. But he did not like children. And she had a 12-ish-year-old child who had some behavioral issues herself and was rather impulsive and would consistently get in the dog's face and eventually did get nipped in the face, even though we were trying to work really hard on that not happening. So other than the child issue, the dog actually behaviorally was very stable. And so I remember reaching out to my client, Ellen, who I knew had had a dog with a previous child bite history. And she herself does not have children, does not have family that comes over with children, anything like that. I knew she could keep this dog safe and the community safe, also important. And Shiloh is probably 11, 12, 13 years old. Maybe Ellen eventually will pop in and say, and he's lived an amazing life because we found the right home for him, the right environment. He's an amazing nose work dog too. Mallory says, I think in general, we can drive ourselves crazy thinking of things that we could have done better for our dogs. It is an endless line of thought. That is true. Because we can do it in the moment, it's the best that we have and resolve the issues. And I just want to say, like, if you are working with a training professional, a veterinary professional, I want to see that they're continuing to learn. They're going to continuing education events. They're doing, activities. They're expanding their knowledge. I think of earlier training clients. A little Jack Russell I saw, one of my very first clients as a professional, and he licked things obsessively. And the vet told them to go to training and really actually dismissed them, that it was a OCD type behavior. And now that I know better, I would have sent that dog to a specialist and found some more information, probably an internist, because I'm pretty sure looking back on that, he probably had some GI issues. That's why dogs lick things. That's one of the reasons dogs lick things. So GI issues, allergies, things like that. I still gave that family really amazing help. They had a great life with that dog, and they really did have a much better relationship. But looking back, I know I could have done things differently. But that's okay, because that's what keeps me motivated to continue to move forward and to do my job well. And so that's why I wanted to talk about this a little bit. Let's let go of that guilt and that shame. We could get in that spiral all day long, but what can you do going forward to make it to help other people see the difference? So I want to I'll stay on I'll ramble for another minute here. If anybody wants to put any comments in, and thank Maya Angelou for that great comment of know better and do better, and keep learning, get knowledge, do better, strive for better for our pets, for yourself, everything. I think it's just so important. And I hope you got something out of this talk, and I didn't ramble too much about a little bit about my personal stuff, but I think it's all applicable to other people's struggles with their pets who have behavioral issues. And if you have any questions or comments when you're reading this after, or watch reading, oh God, watching this afterwards, please feel free to leave a comment in there. We'll come back and make comments. Like I said, we did a really fun Facebook Live last night with Lorena, the other trainer, and I. So feel free to click on our live tab and go look at that. We answered a lot of really great questions. Thank you, Mallory, for saying you love my personal stories. I'm sure you've heard lots of them over the years. the Once again, I'm Sarah McLeodry from Synergy Behavior Solutions in, well, I'm going to say slightly sunny Portland now. It was really sunny when I started. That's Portland in the winter for you. Have a great day and let us know how you guys feel about knowing better and doing better, and what are you doing to do better for you and your pets. Have a great day.